So you were recently prescribed an EpiPen or some other type of epinephrine auto-injector. These are the devices that are prescribed when people have some type of severe allergy that's potentially life-threatening. So I'm here to review with you how to use the EpiPen, when you should use the EpiPen, what it's for, so you feel comfortable with it and you're able to use it if you need to in the future. So the EpiPens or the epinephrine auto-injectors contain epinephrine, which is also known as adrenaline. So all you're giving yourself is an adrenaline shot when you have these types of reactions and you treat them. And so they come in many forms, but this is a common form, and this is a trainer that I use to show patients how to actually use their EpiPens. And so this looks like one of the devices. Yours might look a little bit different, but I'll go over some of those differences. But in the end, it's all the same medication essentially. So first thing is when you go to the pharmacy and you pick up your EpiPen or other auto-injector, you want to check the expiration date. I've had several patients where they go to the pharmacy, they get their EpiPens, they leave and they realize they're going to expire in a month or two, and then they have to get them replaced right away. These devices should last for at least a year. So make sure you double check at the pharmacy before you leave. Now, these devices tend to have a clear window on them where you can actually see the medication. And the reason for that is you want to look at it every once in a while to make sure it still looks like it's good. If it gets too hot or if it freezes, the medication will go bad and that medication will get cloudy. So when you look at that window, you want to make sure the light shines through and it's not really cloudy. Don't leave them in a glove box. If they get too hot, they go bad. If they freeze, they go bad. And of course, it's no good if it's not with you. So you want to make sure it's easily accessible wherever you go, so in case you need to use it, you can. Patients tend to have allergic reactions when they least expect them, so just make sure you always have it wherever you go. Now on the flip side, when there's a delay in using the epinephrine and there's a bad allergic reaction, people die. Fatal reactions do occur, and whenever you hear of those stories in the news where someone's died from an allergic reaction of some sort, it's always because there's a delay in using the EpiPen. So you don't want to hesitate using that EpiPen when you think you need it, because you're not going to hurt yourself using the device or giving yourself the medication. You have my permission to use it whenever you feel like you need it. So you want to err on the side of using it rather than not using it in a situation where you're having an allergic reaction. Patients typically have some questions about, well, when should I decide to use it? What you should think about is if anything is happening on the inside with those allergic reactions. So if the throat is swelling, the voice is changing, in the child there's a hoarse cry, having trouble breathing, if there's dizziness or if there are hives all over the body, those are big allergic reactions and they need to be treated right away. So let's say that happens, that you get stung or you eat something, you're starting to have one of these reactions where your throat's swelling. First thing you need to do is grab that EpiPen. So when you hold these, it's important to hold it like a fist. You do not want to put your thumb over the end of these. And I'll review that in a little bit as to why. So you go to grab your EpiPen, you hold it like a fist. Now the next thing you'll need to do is remove the safety cap or caps. So depending on which device you have, they'll either have one or two caps on the ends that keep it from accidentally going off in a bag or a purse. So you have to remove those for it to work. So in this case, there's just the one safety cap. So you hold it like a fist and then you remove that safety cap. Now the next thing to do is to go for your target, which is the thigh muscle. So the big thigh muscle is where you want to get that medication. So you set it on that muscle there. Now if you're wearing pants or any clothing, that's fine. The EpiPens will go right through the clothing. You don't have to take off any clothes. They'll go right through. Now you want to make sure there aren't any keys or wallets or other things in the way. But as long as it's just clothing, you can just set the EpiPen in that area. Now you don't need to swing the EpiPen or do anything dramatic. People will miss the spot that they're aiming for when they do that. I just want you to set it on the thigh muscle. Once you've set it on the thigh muscle, then you need to push firmly and it clicks. You'll hear that clicking noise, and what that is the device is releasing a spring-loaded needle that then goes into the muscle. You need to hold it there for 5 seconds to let the medication actually go in. So you just need to count from 1001, 1002, 1003, 1004, 1005. Now, once you've done that, you can release the EpiPen. On many of them, they'll have a portion that pops out to cover the needle so that people don't get poked, and then you just set it on the side. Now at that point, you should start feeling better pretty quickly. In a minute or two, the throat will open, your breathing's better, you're not as dizzy. But I still want you to call 911, and the reason for that is after 15 minutes, like I mentioned before, the medicine's out of your system. Sometimes the reactions can come back. And I don't want you or anyone else driving or trying to figure out what to do next. It's much better to have the ambulance come and check you to make sure everything is okay, and then decide if you have to go to the hospital from there or not. So the bottom line is, as long as you have your EpiPen available, you know you're going to be safe and you're going to be okay. Yeah, again, these reactions happen when they're least expected, but as long as you've got this with you and you're able to and willing to use it, you're going to be fine.